Listen to me. We need to talk about your money, your health, and the absolute reality of what is coming for you as you age. Because if you don't understand the rules of the game, you are going to be the one who loses. And when it comes to Medicare, losing means thousands of dollars flying out of your pockets when you can least afford it. You are sitting there, maybe you're 64, maybe you're 72, and you think, I have Medicare, I'm safe. You think that because you worked hard and you paid into the system, that the system is going to catch you when your body starts to creak and fade. But I am here to tell you, Medicare is not a blank check. It is a complex, sometimes cold, financial roadmap. And if you don't know where the potholes are, you are going to wreck your retirement. Let's talk about your eyes. You're noticing the world is getting a little blurry. Colors aren't as bright. You go to the doctor, and they say the word, cataracts. You're scared because your vision is your independence. You ask, does Medicare cover this? The answer is yes, but only if you play by their rules. Medicare Part B will cover cataract surgery because it is medically necessary. They will pay for the surgery and a standard, monofocal lens. That's the lens that helps you see far away, but you're still going to need glasses for reading. Now, here is where they get you. The doctor is going to offer you the fancy lenses. The multifocal lenses that promise you'll never need glasses again. They'll call them premium. And they are premium. But Medicare will not pay for that upgrade. You will be on the hook for the difference, and that can be $2,000–$3,000 per eye. Are you prepared for that? And don't forget your deductible. In 2026, your Part B deductible is $283. You pay that first. Then you pay 20% of the Medicare-approved amount. Do not let a free surgery turn into a $5,000 surprise because you didn't ask the right questions. Then there's your mobility. Your hip. Every step is a reminder that you aren't 20 anymore. You need a hip replacement. This is a massive, life-altering surgery. Medicare does cover it, but only if you have documented proof that you tried everything else first. Physical therapy, shots, canes, you have to prove you are failing conservative treatment. If you just walk in and say my hip hurts, fix it, they might say no. And look at the costs. If you are an inpatient in the hospital, that's Medicare Part A. In 2026, the Part A deductible is $1,736. That is what you pay the second you are admitted for a benefit period. If you stay longer than 60 days, heaven forbid there are complications, the costs start doubling. But wait! Many of these surgeries are now being done as outpatient. If you go home the same day, that is Part B. Now you're back to that 20% coinsurance. 20% of a $30,000 surgery is a lot of money, my friends. If you don't have a Medigap policy or a Medicare Advantage plan that caps your out-of-pocket costs, you are playing a very dangerous game with your savings. And finally, we have to talk about the one that breaks my heart. Your hearing. You're pulling away from conversations. You're turning the TV up so loud the neighbors can hear it. You need hearing aids. And you think, of course Medicare covers this. It's health. Wrong. As of right now, in 2026, Original Medicare, Parts A and B, does not cover hearing aids. It does not cover the exams to fit them. It doesn't cover the batteries. It doesn't cover the repairs. Nothing. This is a law that dates back to 1965, and while people are fighting to change it, it hasn't changed yet. A good pair of prescription hearing aids can cost you $5,000, $6,000, $7,000. So what do? You have to be smart. If you need hearing aids, you must look at Medicare Advantage plans, Part C. About 97% of those plans offer some hearing coverage. Or, you look at over-the-counter hearing aids if your loss is mild. But you cannot just assume it's covered. Assumption is the mother of all financial disasters. I want you to be powerful. I want you to be in control. So here is your actionable takeaway. Today, I want you to pull out your insurance card. If you only have original Medicare, I want you to look at your bank account and ask yourself, can I afford a $5,000 medical bill tomorrow? If the answer is no, you need to look into a Medigap policy or wait for the next open enrollment to find a Medicare Advantage plan that fits your needs. Do not wait until you are in pain. Do not wait until you can't see the faces of your grandchildren. You must be proactive. You must value your money as much as you value your health, because in this country, they are one and the same. People first, then money, then things. But you can't take care of your people if you've let your money slip through your fingers because you didn't read the fine print. Stay safe, stay smart, and for heaven's sake, stay informed.